constant nausea or this feeling of vomiting but no vomiting. This is a hallmark of pregnancy. The moment the pregnancy hormones, beta HCG, estrogen, progesterone start rising in your body, this is what will be the side effect of it. It's the same side effect when you take a birth control pill. Estrogen can produce a lot of nausea and the HCG. Some patients actually get to know that they're pregnant the moment they start getting nauseous. Now, if you're a first-time mom, or this happens to you like almost every time you are having constant nausea and you can't eat, most of my patients or their husbands or their in-laws, they would keep asking, but she's not eating. Shouldn't she eat? And then the more they understand that you're not eating, they get scared that something is wrong with you, as in you will die or the baby will die, and they will try to make you eat more, because that's how they have cared for them, for anyone. Like, we as human beings know to care for each other through eating. But you are nauseous, and there are so many patients who just avoid eating to avoid the vomiting, so they just stop eating. Now, there is something called as morning sickness, and there's something called as hyperemesis. So morning sickness, it's not just specifically in the morning, it can happen throughout the day, but it's like sickness, just nausea. It doesn't really affect your health. Whereas hyperemesis is when you start vomiting so much constantly that you're not able to eat anything, and you start having electrolyte imbalance, you start losing weight. That's what is hyperemesis. I hope you don't reach that place. Patients who get hyperemesis are very typical, as in they have issues with eating. So most of the time, those people who are very thin, or they never really liked food, they use this nausea as a reason to not eat. So I don't know which one are you. If you don't have that sort of relationship with food, I think you're gonna be fine. You will get nauseous, and some patients do it opposite. They actually love food, so they use nausea to eat more, because eating has always made them feel better. So some of them will actually go and start eating sweet candies to suppress the nausea, or to eat first thing in the morning to suppress the nausea. Nothing is wrong in first trimester. As long as you don't lose weight too much and you don't gain weight too much throughout first trimester, you'll be fine. Now, nausea is a feeling. It is a perception in your body, and it generally ends with vomiting, especially if you're ill. So if you were hungover, if you had some medication, or if you had a bug in you, generally that nausea will end into a vomiting. Whereas in pregnancy, it doesn't end. It just stays, and it increases from 8 to 12 weeks, it's maximum. And it starts suppressing, it starts becoming less by 16 weeks. Some will actually say the moment I hit 12 weeks, it was gone. And some will keep having nausea throughout pregnancy, when they drive, when they sit it behind, all of that. So nausea is a pregnancy symptom. When someone is forcing you to eat, you don't have to eat, but understand you need to eat a little bit. Little meals, little drinking, anything is better than nothing. And don't overeat, because that might make it more. Don't think, like we will always tell our patients, if you eat, they will feel better. And yes, you will, but be careful what you are choosing. Don't eat junk food, because that can really, like, the foundation of your pregnancy will start with a lot of weight gain, and I don't want that for you, especially if you're health conscious, weight conscious. I want you to gain weight in a very healthy way. All right.